7. Well, after a week of bad headlines, the state government has caved to pressure and agreed to stump up $50 million as a short-term fix for our hospitals. Now, $50 million won't probably go that far. It's being called an infrastructure maintenance fund to focus on ageing equipment at Sir Charles Gardner, Royal Perth and Armidale hospitals over the next 2 years. So what do doctors think about the cash injection? Dr Kyle Hoath is the AMA president in WA. Good morning.
Morning, Mark.
Is it too little, too late? What are your thoughts?
Oh, look, I think it's actually a good start. We go about telling these stories and trying to bring attention to these issues so that the government can take it seriously and do something about it. And this is at least an attempt at that. And whilst it won't get us all the way, we're pretty thankful to actually see some action on this.
How bad is it? How bad is the ageing equipment and infrastructure in our hospitals?
Can't believe how many phone calls and messages I got from colleagues and members and friends that have either been patients or doctors or nurses in Charlie's and other hospitals over the last week sharing their war stories. I think it's pretty bad.
Like what?
Much of what you already saw in the media, I guess. The aging infrastructure, the difficulties with fixing things that would then break again. I think we heard a few stories around what happens when they try and fix the water pipes only for them to break again soon after. So yeah, we knew things were bad, and it's good to see some action.
So they've identified 3 of our older hospitals in Charlie's and Royal Perth and Armidale. They're top of the list, I suppose. Do other hospitals need it?
Yeah, so I think King Eady's is the other one that I would point out as needing some desperate support around infrastructure. I know we're building a new women's and children's hospital, but that doesn't mean we can just let King Eady's fall further into a state of ruin while we wait. So
because it's years away.
Yeah, one missing. Yeah, exactly. So that's probably the main one missing off that list.
Yeah, okay. And just from a patient perspective, I mean, should we be concerned when we see these images and hear these stories from doctors and nurses and people working in hospitals? It looks pretty alarming. I mean, that's why the government has acted, I suppose. But should patients be worried?
No, not in terms of whether or not they should or shouldn't go to hospital. They shouldn't be worried. Thankfully, a lot of what we see is in the more communal and sort of transfer areas rather than certainly not our operating suites. And most of the wards or the rooms aren't what was represented in the media last week. And the staff there are doing an amazing job. Like our doctors, our nurses, all our healthcare workers aren't going to put patients at risk. They're going to kind of bend over backwards to make sure people are looked after. So I wouldn't be worried about going to hospital, but it doesn't change the fact that we're seeing what happens when we neglect to maintain these incredibly important parts of our society. We can't just let a hospital fall to ruin.
Oh, indeed. I mean, there was no suggestion of anything on the part of the staff who work in the hospitals that they wouldn't be doing their absolute best. My question was just totally reliant on the images that we've seen and the stories we're hearing about the equipment itself. And if you don't maintain the equipment, surely there could be some concerns for patients. I mean, I'm not saying that people don't go to a hospital, but, if the equipment is that bad, there could be some health implications, surely.
That's the bit we're worried about, right? That's what you don't want to hear is a story of horrendous outcomes as a result of this, lives lost or people becoming more unwell. That's what that would be the disaster, and hopefully this goes away to avoiding that. But at the very least, bringing it to the attention of the government and the management of the hospitals will help us hopefully steer away from that. But you're right, like it's sort of staring down something apocalyptic when you start to see your hospitals filled with mould and fall apart.
Yeah, you're listening to Dr Kyle Hoath, the AMA WA president, on 7:20 ABC Perth at 7:17. So can you give us a feeling, Doctor, about the $50 million? I mean, how far do you see that going over the next couple of years? Do you think that's enough? I mean, you're always going to be crying out for more.
Yeah, look, I don't think it'll be anywhere near enough, but that doesn't stop it being a good start. I think even the task force in particular to do a bit of an audit around how hospital infrastructure is maintained and where that funding goes is another positive I would have taken out of the announcement yesterday, because I think understanding where things are at and where the problem might be will likely shine light on other things that need some sort of funding or spend to bring up to scratch. So, no, it's not enough, but it's a very good start, and we'll see what comes of the audit, and we'll be making sure we stay sort of front and centre in those discussions and keeping an eye on how things progress.
Yeah, I did want to ask you about that. So a senior public servant in Michael Barnes and the former Health Department boss, Neil Fong, they're the two people who have been tasked with this sort of audit or review. How wide do you think that will span? Is that across all hospitals or is that focused on those three as well?
Yeah, I believe it's focused across all hospitals and just how the spend and maintenance of hospital equipment in general is done in our state. So I think it's a bigger piece of work than just those three hospitals. An important piece of work, though, because it's, again, really, we should never have found ourselves in this position in the first place. And so hopefully that goes a ways to helping us understand why so we can avoid it in the future.
Yeah, that's the thing. I mean, finally, really, how did it come to this? We've waited so long, haven't we? It sounds like action should have been taken much sooner.
Yeah, I think our health spend has lagged behind a bit in recent years, and that we have a growing population, we have an ageing population. People are sicker after COVID, but even before COVID, we were facing similar problems, and it's just mounting year on year. And we see that with ramping, we see that with the state of the hospitals, we see that with people's inability to access their GPs for basic care. Like we really need to take that investment into our health system so that we can steer it back in the right direction.
It is a very important part of society. Thank you for your time this morning. Dr Kyle Hoath there, the AMA WA President.